Alrighty, guys. So for the last two muscles we're going to go over for this lecture, longus colli, longus capitis, I found this model to be a much better usage of the video than the drawing that I did. So I'm going to go by this because you get to see some elements that I think are really important for learning this muscle, but especially when it comes down to treatment. So obviously this would be the what's left of the occiput and sphenoid as it sits on top of C1, this being C1, okay? So we have some brainstem, mesencephalon, cerebellar stuff up here. Don't worry about all that. What matters is this muscle here and this muscle here. So obviously we're right on the front of the cervical spine. We're going to start with longus colli or longus colli. And here you see a pretty expansive attachment all the way up to C1. Now what you're going to see in your book and you see generally is going from C3, all right, so a little bit lower down to start with. So so this is C1, C2, this would be C3, all the way down to T2. Okay, so into the thoracic vertebra. I think whether or not you include it, if I treat it, I definitely try to go as high up as I can possibly get into the anterior cervicals. It's not a rotational muscle, so its impact over that atlantoaxial joint I don't think matters so much, but obviously you'll want to learn it by the book that we test from. So C3 to T2 is what you want to learn here, C3 to T2, okay? And for longest capitis, it's going to be also starting at C3 down to C6, C3 to C6, okay, anterior vertebrae, and all the way up to the occiput around the foramen magnum. So this is why this model is really nice, is because it's very hard to draw two-dimensionally its attachment up on the occiput, but you can see it very well here. And that's why it has the term capitis in it, because it's attaching to the cap. Both of these muscles you just need to know are flexors of the cervical spine and head. They are your primary cervical flexors. Really important muscles for treatment and for other therapeutic interventions. But yeah, this is it. Longus colli, just remember C3 to T2, so a little bit lower down, take this muscle and just move it down 2 vertebrae, and this would be perfect. And then for capitis, C3 to C6, inserting on the occipital bone at the anterior foramen magnum.